In today's video, I wanted to talk a little bit about genetic testing and cancer. Hi, my name's Mary Johnson. I'm a registered dietitian and owner of Healing Food for Cancer. And today's video is going to be a little bit more personal maybe than previous videos. I'll mention that I have been doing some consulting for a precision medicine company. And if you aren't familiar with what that means, basically the precision medicine is getting at the very tailored approach that can be taken if genetic testing has been done. And so this company, once genetic testing has been done, can help people with a cancer diagnosis with learning about research that's being done, so trials that they can participate in, pharmaceuticals that can be done. Basically, they're in a position where they can come alongside the care team and just provide insights and an additional opinion about the course of treatment. So that's been really interesting work. And I feel like it's the way that I think medicine is, the direction that medicine is moving toward and should move toward, because we are all, as much as we are the same, we all have genetic differences and variations that, if they are addressed, can have a very positive impact on the outcome of treatment. So going back, it's actually been just about a month ago, I found a lump in my breast while doing a self-exam. And I had actually just been to the doctor and we had been talking about whether I was doing regular self-examinations. And I said, there's so many other lifestyle factors that I pay such close attention to, but that's not something I'm doing on a routine basis. And she said, well, why don't you on the first of the month start doing a monthly self-exam? And so just a few days later on the first, I did, and I found a lump. And fortunately, she was able to get me back into the office right away. And she said, well, we can, given the fact that I had just recently had a mammogram, and I had actually had it before having my COVID vaccine, which there have been some instances where there have been some false positives due to the immune response that is normal, that is staged following the COVID vaccine. But I had had my mammogram first with that in mind. So anyway, I had just had my mammogram recently, and she said, we can either watch it or, she said it's likely, she said it'd have to be a really aggressive form of cancer to have popped up so quickly. I think I had my mammogram at the beginning of May or end of April, in that time frame. That hearing that it could be really aggressive didn't make me feel better. And I said, no, I really want to go and have it checked out. And she said that for insurance purposes, it made the most sense to refer me to an oncology surgeon, even though I wasn't preparing for surgery, because that provider could order the tests that needed to be done. So I had another mammogram and I also had an ultrasound. And fortunately, they determined right away, while I was still actually on the table for having had the ultrasound, that this was normal tissue and that there was no reason to be concerned. And I almost thought, well, do I really need to go see the surgeon now, especially since they're so booked up right now. I ended up seeing someone who was new to the practice who wasn't booked up, but the other two surgeons in the practice didn't have availability until next year, which I can't imagine having to wait that long to get information. And I will say, I didn't stress about this too much. I decided that I was really going to be just determined to wait until I had more information before I really got worked up about it. It's not to say that I didn't think about it and feel a little anxiety from time to time. In the, I guess it was about 2 weeks between the time that I made the appointment and I actually got to go in. But anyway, I kept my appointment with the doctor, and I'm really glad that I did, because we had a really good conversation. We spent about 20 minutes together, and he said that he agreed that he thought that, there was nothing there but normal tissue. But as we talked through the family history, he said, I think you are a very good candidate for genetic testing if it's something that you'd be interested in. So I told him yes, that I was, and he made a referral to a genetic counselor, and I saw her this past week. And I went in with my family history, and I'm not going to go into a whole lot of detail there just to respect the privacy of family members, but there are people on both my mother and father's side who have had cancer. And so I took in a very detailed description for the genetic counselor about the types of cancer, the fact that some family members have also had genetic testing done and were told that the cancer that they had was not of a genetic origin. But I took the type of cancer and the point at which they were diagnosed in life, and we filled in all of the information. And the counselor said, even before having the testing done, she said that she could tell me that I was high risk, and that because of that, but that I was eligible for more frequent screenings, and which no one had ever discussed with me before. In fact, one of my physicians at one point had even said that I could go every other year, which I have not felt comfortable to do, since my mother is someone who has had breast cancer. She actually had it twice. So since my mid-30s, I have gone annually for a mammogram and had expected to continue with that. So there is additional screening that can be done, and that's actually one of the things that can be an outcome of doing the genetic testing. And I wanted to shoot the video today because I'm actually I have taken some additional time after having seen the genetic counselor to just think everything over and think about, are there any additional steps in life that I wanted to take before going down this road. And having thought about it, I think in many ways, this is going to be a relief for me to have more information, because I think it will help to inform future decisions that I make. And I think in many respects it'll be, it stands to be a reason for relief for me, because ever since my mother's diagnosis 20 years ago, when her care team pulled me aside and told me that her diagnosis put me at higher risk, especially since I never had children and didn't breastfeed, that all of those factors combined put me at higher risk. It's a relief to know that I'm going to get some additional information and know if genetically speaking, I need to be concerned. In the meantime, I have done some additional research on my own about genetic testing and the various ways that it is used, and actually this past week went through some training to get certification to do genetic testing with a company different than the one that will be doing my test for these genes related to cancer. As well as, I should say, there's an option to do a broad panel of genetic testing or a more narrow panel, and I am opting to do the broad panel because I really want to have as much information as possible. I really feel like this is a situation where information is power. So what was I saying? Oh, the certification. I did this certification, and it appears that the certification is to, as a provider, to be able to provide genetic testing so that I can tell people not so much specifically about cancer, although I've reached out to this company to see if they do genetic testing for cancer, but theirs is more, I would say it's to help people with weight loss, with things like achy joints and difficulty sleeping. All that, all the information that comes back provides information to the provider about the biochemical pathways that impact things like sleep and ability to lose weight, ability to recover from physical fitness, just a lot of really interesting information. And it is something that I'm pondering about whether or not it's something I'd like to be able to offer to clients that I work with. So I'm curious if it's something that you feel like you would do. I would love it if you would drop comments in the comments section below, or if it's something that you feel really hesitant about. There are laws in place about not being able to kick you off your medical insurance, and the genetic counselor said that although it could, there's more, I guess, gray area around how it can impact both life insurance and disability insurance. So it could create a situation where either you would be unable to get those types of insurance, or it could just be that that the genetic testing would increase the price, but of life and disability insurance. In any case, I'm going to get the blood drawn this afternoon, and we'll be sharing the outcome. So what will happen is in several weeks' time, I will meet with the genetic counselor who will have the results. We'll go through them together and then discuss next steps. And I'm really open to what what the outcome might be and what this might mean for me. And I, years ago, seriously considered having a voluntary mastectomy just because I was so concerned after having seen my mom go through breast cancer twice. I was so concerned about what the future held for me. And I think that's why, as I mentioned earlier, having this information to me feels just like a huge relief to know that I'm going to learn more, because it's been in the back of my mind, and it certainly in a good way has informed how I've lived all these years. So I will be sharing more as I learn more, and I hope this video has been maybe a source of something that will get you to thinking about, is genetic testing something you would consider either for cancer or just for general lifestyle habits. Would you want to know genetically about variations in your genes that might make you more prone to illness, or do you feel like you don't want to know and you just want to keep going and living life? I don't think there's any right answer with this. I think it's a very personal answer, and obviously, my family history has brought me to this place where it's something that I feel very drawn to do. So with that, I'll close with my usual disclaimer that this is not in any way intended to be medical advice. I urge you always to discuss any care with your care team to determine what's right for you. Thanks so much for watching, and I look forward to providing updates for you soon. Bye-bye.